Hi everyone. So today we are going live with Dr. Charan Teja, who's an MBBS and MD consultant neuropsychiatrist with KIMS Hospitals and associate professor VRKMC Hyderabad. He's a renowned neuropsychiatrist from Hyderabad. He's been working as a consultant with KIMS Hospitals, Kondapur, and as an associate professor with VRKMC, where he's been mentoring many junior doctors. So his areas for expertise include mental health issues such as stress, depression, anxiety disorders, sleep disturbances, and many such issues which we are usually sometimes are facing. So I will just wait for doctor to join us. Hello, doctor.
Hi, Acharya.
Hi. Thank you for coming with us.
Thank you. It's a privilege.
Thank you so much. Thank you so much. How's your day going?
Hectic.
I can imagine.
How are you doing? How is your day going on?
Good. Lots of stuff going on, but yeah, was looking forward to having this live with you, and it's a privilege for us to have you here with us, where we could kind of talk on a topic which is so deep and so connected with everybody. So it's yeah. It was busy, but then yeah, I was kind of showing that it goes really nice and things go. So yeah. Would you like to talk something about yourself?
Oh,
Introduce yourself.
yeah. I think you introduced me already, but for everybody who's watching, this is Dr. Sharon. I'm a consultant neuropsychiatrist. I'm based out of Hyderabad. So I'm working in a hospital called KIMS right now. I just came back from the hospital very quickly and sanitized myself for this live.
Okay. So, what would like to kind of we will talk about. I would like to understand like how did your journey, being a doctor start? Like about your journey, and did you like always know that you wanted to be a doctor, or that something came up?
I mean, I think more this applies for I think most of the people who become doctors. I think we just don't know to do anything else. This is the only thing we know to do. Um I think even even other life skills, etc., etc. I think we're not very good at. I think all we do is look at people, look at diseases, diagnose, treat, look at the prognosis. I mean, as a child, obviously, I didn't know that, but the funny story is that someone told me that you look like a doctor when I was a child. It just
That's
didn't make sense to me. Probably because I looked fair, and I don't know. I mean, there is a colorism in our society, right? Where they just feel like, oh, doctors are fair and they wear glasses. Growing up, I heard that whenever I used to go visit doctors, they all have glasses. So I had glasses as a child. So a lot of people thought that, oh, you look like a doctor, you should become a doctor. So that's when I thought, and then once a bug gets into your head, I think you start thinking about it. Same goes with anxiety also, which we'll talk later. So I started thinking that is it a viable option, etc. And it got me curious, and I'm naturally a very curious person, not in others' life, but about science. About science, I'm very curious. So I think that's how I ventured into that path.
so like yeah. So it was like for you was it was you never as a kid, when we are always with our parents are like मेरा बेटा बड़ा होके ये बनेगा मेरा बच्चा they kind of put those words in our head. It starts coming from them also at times, when you're constantly listening to something that my parent is your parent is telling you, it's somewhere starts playing a role in your mind, then you start doing role plays. Did you also do role plays when you were little kid as a doctor?
No, in fact, actually, my parents, I mean, we have a lot of doctors in the family. So a lot of them discouraged me from becoming doctor. They said, it's like not a very like, especially in a country like ours, where a lot of people think that, doctors make a lot of money, etc. But in the years of hard work, the time that you become completely independent, but still have to work under someone, the work culture isn't good for doctors, especially in India. We are always overworked and we glorify hard work. People who work hard are the ones who are brilliant doctors, etc., etc. So, usually most of the doctors, they don't encourage their kids to become doctors. So my parents told me like, are you sure you want to be a doctor? Why don't you become an engineer? One of my uncle has he owns his own company in USA. He said probably you can just fly to US at the age of 21 and you can actually make a lot of money in dollars. Why do you want to be in India, study till 30 years and struggle and, all of that. Like, so my parents discouraged me from becoming a doctor and they said that, whatever you want to do, but don't feel like, oh, doctor is such a great thing and don't be so heroic. Think about your life also. You have to think about yourself first and then think about society, etc. Because as a child, you always feel like, oh, I'm a superhero, I can heal the whole world. That notion, my parents fortunately have discouraged from. So I was able to take my own decision if I want to become this or not. And when I take my own decision, even if I fall flat, I know that it's still my decision and I don't have anyone to blame to. Right? That's always a good thing that I practice.
That's nice. So let's talk about something where it's where we are here for self-care. And do you think self-care is selfish? Is like being selfish?
No,
Or
absolutely not. Absolutely not. Also, it depends, right? What exactly is self-care to you? If you say self-care is always putting yourself first and not really caring about other people around you, especially your loved ones, and only taking care of yourself, that can be selfish. But self-care, if you define it as I have to take care of myself first before I help other people, that's not selfish. That's actually a very good, essential part of our life.
so if we say sometimes we start taking care of ourselves, and then with that factor, a lot of sometimes we get a guilt inside us. It comes as if saying, I'm only taking care of myself. I'm not. I'm loving myself. I'm pampering myself, and then that comes sometimes with a guilt factor. So, is that how do we not take it to our heart and get out of that guilt that comes with that?
Self-care guilt is a very common problem. Some might address it, some might not address it. I'm sure at some point you felt guilty of taking care of yourself, or you're made to feel guilty of taking care of yourself. It's mostly you're made to feel guilty, especially if you're a woman and if you're a mother. Like I keep seeing a lot of people, right? I mean, men somehow, I think in a different way, they take care of themselves well and they're not questioned about it. But women, especially if you're a mother, right? They always say that, how can she be so selfish? How is she not at all taking care of her kids? She's only taking care of herself, right? Same way they talk about women as, oh, she doesn't care about her husband. All she cares about is herself. Or she doesn't care about her in-laws. All she cares about is herself. I think women usually face with self-care guilt, but I think it's time for all the women to understand that men or women, it's all same. Self-care is same for everybody. And if you are somebody who is not able to take care of yourself, I think you're not capable of taking care of anyone else. I think you should understand that. And self-care isn't indulgence. A lot of people think self-care is just going to spa or getting a manicure done. While that is also good, I'm not saying that's wrong, but it's not just indulgence. Self-care can be talking to people about how you feel, calling your friend. Sometimes I used to ask my mother that, why don't you call your friends often? She says that, where do I get time? Something as simple as, while me as her son, I'm always calling my friends, hang out with them, chilling with them. Whereas my mother is not getting time to call her friend because she's taking care of us. So that's a horrible example of self-care there, right there. So I think like everyone should learn to maybe talk to people. It doesn't have to be a counselor all the time, right? It can be people who are not toxic, people who are supportive. Sometimes your partner might not be supportive. You might have a random one person that is just supportive for you. There is no relation for that, right? You can turn out to those people. You can go for a walk, go do exercise. Like I always used to go to gym before in my college, because I always felt like, because I had depression myself, and after which I started working out, and I started feeling better, along with medicines, obviously. I started feeling better, and I made sure that I am gonna work out all my life, not just because I want to look a certain way. I don't care if I have six pack abs or not. I don't really care. But I always felt like when I exercise, I feel good. So I always used to go and work out. There are days when my friends used to ask me that, oh, can we go out? I used to tell them I have gym right now and we can catch up right after that. They used to tell me that, skip one day, what will happen? It's a very common thing, right? I'm a simple example I'm giving you. What is that? It's just one day gym. But I'm like, no, I want to go to gym. It makes me feel better. So they're like, oh God, like, why can't you just do for other people? Why are you always thinking about yourself? Which is not true, right? But those things, sometimes most of us feel like, oh, we might lose those friends. We might lose those relationships. So we suck up to them and we do how other people want us to do things. But I think it's always good to say that, draw some healthy boundaries and tell that, this is my time and I want to do whatever I want to do. I'll come and join you guys. Please understand. You don't have to burn bridges with them. You don't have to be arrogant about it. You don't have to. There is a lot of difference between arrogance and assertiveness. You can always speak assertive in an assertive tone, right? You can always say no to the things that you don't want to, right? So I think that's one way. How you communicate is one way of letting go of the guilt. And second thing is redefine what self-care means to you. A lot of people do it like work. Like I know, I saw one of my patients' diary today, and she wrote work, family, self-care. These three seem like work to me. Like, I had to work, I had to take care of my family, I had to take care of myself. So self-care shouldn't come as a separate work. It should be a natural thing. Like, for example, before this live started, right, I had 10 minutes. I was just sitting and I put my favorite song and I'm just relaxing. That is self-care. It's not a big deal. It costed no money, right? That giving yourself that time, that is important. I think that those are a few things you can do.
That's a really good way of putting it. I mean, you spoke about things which feel like you're doing nothing, but you're actually just kind of calming yourself and taking care of yourself. That's really true. And so when you're kind of with self care and this guilt you spoke about, what also comes is overthinking. Again, you're doing something for yourself, and then suppose you're also feeling guilty about it, and then when you're guilty about it, you start overthinking on that topic and you go to different tangents. See, what if this happens, what if that happens? So I mean, can you what are the ways that you can, so you said ki self-care is normal. I mean, that's not something that is wrong. So how do we address that in a way that we stop overthinking also, that guilt factor does not go to the next level?
I think overthinking is a very subjective word, right? Sometimes when patient tells me that, doctor, I'm overthinking, when I ask them, what are you overthinking about? They said that I have a loan coming up and I'm thinking about how to pay it. That is not overthinking. That is you thinking so you can find solutions. Now, see, you have a brain that is supposed to be thinking. You can't stop that. A lot of people think that, oh, when psychiatrists prescribe medicines, you'll stop thinking. No, that's not going to happen, right? It's just that I think going from one negative thought to another negative thought, or let's just say one negative thought triggers a chain reaction in your head. For example, today morning, right? Today morning, somehow my alarm went off. I was supposed to be taking class for MBBS students at 9 o'clock to 10 o'clock. And I'm usually on time. So today, somehow my alarm went off and I woke up at 10:15 and I had like 20 missed calls from like the coordinators. So immediately I started having a little bit of anxiety. Then I told myself, okay, you know what? It's okay. It's over, right? Now let me not focus on the problem. Let me focus on the solution. Immediately I had called. I said that my alarm went off. I'm really sorry. And can we reschedule the class to Saturday or whichever day they're comfortable? I don't even mind teaching on Sunday if you guys are okay with it. So overthinking will stop when you start focusing on a solution-oriented thinking rather than the problem-focused thinking. right? Sitting and talking about problems is not good. It creates a lot of anxiety and stress, and it affects your mental health and physical health. But thinking about solutions, if you're overthinking for the solution, that's actually a good thing, and you can do it. That is one thing. Another, I think this is the one fantastic way that works for me, right? I always postpone my thinking. I always feel like I'm busy right now. I'll do all my overthinking in the evening. So like I come home from the hospital at 4 and I start taking calls from 5 again online. 4 to 5 is my time to relax. So in that half an hour I put as overthinking time. It's my worry time. I always tell myself that, you know what, I'm gonna worry between 4 to 4:30. Now let me not. So even in the morning, if something happens or if there is an argument with another doctor or whatever it is, instead of sitting with the thought and letting it affect my day or my productivity, I'll be like, you know what, I'll deal with it later at 4 o'clock. What happens is at 4, whatever is not important, you will not visit those places. By then, all those thoughts would have diffused off. But whatever is important that needs to be thought about, you will actually sit and think about it. And my alarm goes off at like 4:30, and that's it. I stop. So I think setting aside a worry time is very important and focusing on the solutions rather than problems. I think these are two different ways that practically will help for you.
Okay, that's a good way of thinking actually, kind of putting yourself into a time space. Okay, this time space is my only time space when I'm gonna sit, and if whatever is it'll be taken care of at that point of time. So then the entire day you're not focusing on that, you're not worrying on that topic, and you're doing the other things which are more important. And
Yeah.
obviously the way you said, focus, if overthinking on the solution, that's good. Overthinking on the problem, that won't help. Find the
So
solution to the problem.
yes, and there's one more exercise where you can do. I start doing it, it actually is helpful where I take a paper, I draw a circle, and I write everything that I can control within the circle and everything I can't outside the circle. And most of the things that we worry about, the things outside the circle, oh, what did he think? What did she think? You think that person would have liked me or not, etc., because that's clearly not in your control, right? So when I look at that, when I draw a boundary, I think it certain registers in my brain that, okay, this is something that I don't have control about, where while some of the things I may influence, but I don't have absolute control over, right? Absolute control over. So recently I started making 3 circles. One is what I can control, what I can influence, what I can't control. So it gives me a little more clarity that, okay, this not control box, I shouldn't even worry about because I can't do anything. I'm not a god. So I think that
True.
gives a little more perspective. And writing down helps always than thinking, because clearly you're overthinking and you don't want to add one more thought to it. So write it down. That's the vent out. Don't put it on your phone. It's always good to hold a pen or pencil and write it on the paper, like good old way. There is a hand-eye coordination. Your nerves are stimulated. There's so much that I can speak as a doctor. So much happens when you write down things.
True. Yeah, correct. That's a good way of doing actually. Like some people write, they do journaling. They write it down, and some people, because I think writing it down also helps release, like you said, vent out. Write it down.
Yeah.
It
Yeah.
helps. That's true. So, would you like to give some tips on how can we kind of get rid of the anxiety and stress? Like, this entire stress causes anxiety
Right. So I see.
and stress.
I think the most important thing is you can't get rid of stress. Stress is constantly present in our lives, and you have to accept the fact that there's always going to be some stress or other. If not this, something else will always find its way. Because we are, to be very honest, we all are living in stressful situations and environments. Maybe familial issues, maybe partner issues, or maybe issues with your children, issues back at work, financial issues. There are always a lot of issues. But understand how you start reacting towards it is something that is in your control, right? While you may not be able to control if your boss is going to fire you or not, but what you can
Yeah.
control is you to have a plan B if you're fired, or to do work efficiently so you're not fired. Only that is in your control. So maybe you can focus only on that. So understand that a lot of people think that, oh, when they come and visit me, the stress is going to go away, right? So unfortunately, there is no magic that I can do that will make stress go away, right?
Yeah.
However, if you're able to do some basic things right in your day, that stress might not turn into an anxiety disorder or a depressive disorder that requires like treatment. The first most basic thing is sleep. I think people who are poor with sleeping are the ones who are more prone to developing both mental and physical health conditions. I mean, every time research have shown the same finding and not otherwise. So people who are sleeping deficiently, they'll have to immediately see a doctor. There is a big myth that sleeping pills are so dangerous, but understand not able to sleep is even more dangerous, right? And there are many sleeping pills that are quite helpful. Even I take some medicines once in a while if I'm not able to sleep, which is fine. There's nothing wrong with it to take an aid. For example, you have fever and you're trying to externally cool yourself, sitting in the air condition, or using a wet cloth to reduce the temperature. If it's not working out, you do take a paracetamol. Sometimes you
Yeah.
need something to regulate your functions. The same way sleep. So there are many tips that I can tell about sleep, but I think right now that turns into another whole topic. So taking care of your sleep is very important. Second thing is having exercise, especially homemakers and women who are working at home. Whenever I ask them, do you work out? They say that I do a lot of household work. So that is not workout. That is strain. That is you doing the same cleaning with the hand over and over again, where your neck and joints are getting degenerated. That is not workout. While husband is happily going to gym and working out, right? So what you can do is both of you can go to gym together because you both need exercise because both of you have health that needs to be taken care of, right? So exercise is the most important way, and exercise is not just that 1 hour of gym and being lethargic like a sloth rest of the day. Exercise is you being active in a tiny little way throughout the day. For example, taking flight of stairs whenever you can, right? Like like I park my car in basement number 2 and I go to ICU in 4th floor. That's how I start my day. I go to ICU first. So when I'm getting into the lift, I see a lot of youngsters stopping the lift in between and going from first to second floor or second to third floor. I always ask them, "You're very young, no? You don't have any joint issues. Why can't you take flight of stairs?" They don't answer back to me rude because I have an apron and a stethoscope. They say, "Sorry, doctor." That's not for me. Why I'm saying that is doing the simple changes in your day makes you a physically active person. That's why back in the day, our parents and grandparents lived quite healthier.
Correct.
They had naturally six-pack abs and naturally veins bulging and biceps, etc. Because they went to gym. They're working out in the sun, they're working hard. While you can't do all of that, some of the habits maybe you can inculcate and do them on a routine. Sleep, exercise, and hobby. Hobby is a great way for you to take care of your mental stress. When I say hobby, everybody tells me, what are your hobbies? I watch movies, I listen to music. That is not a hobby, that is a time kill. You're just trying to pass time. Hobby is something where you are creatively stimulating your brain, which is not your job, right? For example, I do painting, I do photography. So likewise, you can do dancing, you can learn to play an instrument. You can read books, right? Books which are like probably that are good. So I think different hobbies are, I think when you have a hobby, your self-care also is taking care in that period because you're enjoying what you're doing. That is not your job. Sometimes all of us don't enjoy our jobs. We just do it like to survive, right? It becomes bread and butter after a point. Whereas hobby is something that you can have fun with. So I think these are a few different things you can do to probably like reduce stress.
Yeah, I mean, thank you. I mean, these are smallest things that we can do and definitely help us in the long run. I mean,
Yeah.
small changes in our lifestyle that we can start making and which will help us deal with the larger issues. Is there anything that, like suppose many people, when they have stress, they start eating more. So is there, how do we deal with something called stress eating?
Yeah, I do it too. Right, I'm sure like instead of knowing what to do, I still go ahead and do stress eating, which is a very normal thing, I think. But however, if you're finding yourself doing it every time, for example, some people smoke when they're stressed, some people eat when they're stressed. When it's becoming a daily pattern, that obviously causes a lot of physical health issues. You need to understand that. I think one simple, I think it's a great tip that should be tried by everybody, and it works. You know, your hunger doesn't come from your stomach; it comes from your brain. There is an area called hypothalamus, which we all studied in school. There is an area called hypothalamus in your brain, like below your brain, that has a small area called feeding center or satiety center. There is a thirst center. Now, the appetite center and thirst center are right next to each other. So it's supplied by the same nerve. I think I'm getting a little mechanical, but I try to understand. Both the areas are supplied by the same nerve. So even if you're thirsty, a lot of times you think that you're hungry. At night, 11 o'clock, you might feel hungry. That's not hunger, that is thirst. It's a false alarm, false signal. So what we do is we immediately go and like grab a bag of chips or something like that and eat. So what you could do is have like maybe like a half or three-fourths of a bottle if you can. When you fill your stomach, it sends signals back to the hypothalamus that, okay, it's taken care of. Now stop making this person feel hungry or thirsty. And it stops. That's how your body is, wired. So you can always quench your thirst if you think you're feeling hungry, or quench your thirst when you're feeling stressed. Another thing is, don't stock any bag or packaged foods in the house, right? So, for example, let's just say you're in a stressful period right now. You're in a horrible project, right? And for the next 1 month, you're going to be stressed. You know that. You could anticipate the stress right now. And you know that you're going to go and do comfort eating every day. So don't go to a supermarket and get a lot of chips packets. So what you can do is ask your domestic help or whomsoever to cut like a lot of vegetables and fruits and make like 4-5 boxes of salads. So when you want to do stress eating, you can go and eat the salad. Actually, that relieves stress. A lot of greens, a lot of fluids, which are rich in vitamins and minerals. They relieve stress. If you eat greasy, oily food, it will worsen your stress. If you eat sugary food, which you all turn to, right? Desserts is stress spelled backwards or some nonsense, right? So when we do that, that actually makes it worse. So I think there are two simple things that you can do.
Thank you. These are mostly we get temptations to eat in the night only, majority of us. And that's the time. And yes, sometimes when we're really upset, we're overthinking on something and we just get tempted to eat sugary foods. That's the time when we want to just eat sugar and candies and cakes and chocolates. But yeah. So, doctor, is there anything something like health anxiety?
Which one?
Something like health anxiety?
Yes, health anxiety is there, which is very, very, very common, where you start feeling like, oh, I'm having chest pain or chest discomfort. Probably I'm having a heart attack. Or if you are telling me that, hey, yesterday my aunt got admitted in the hospital because she was losing hair for like last 6 months and we didn't do anything about it. And the doctor said it's cancer right now. So immediately you start relating yourself to the, oh my God, even I'm losing my hair. Probably I'm having cancer as well. And you start Googling about that and you start associating or relating yourself to a lot of symptoms. And then you obviously freak out, you have a panic attack, you go to a doctor, you get tests done, etc. Health anxiety is there. I would request everybody, please don't use Google as a companion for your medical problems. I know it's much easier, it's just one click away. But more often than not, it usually damages with your brain in terms of, for example, right now, I have a headache, right? And I Google I have a headache. It will show 10 things. It will show hydrocephalus, brain tumor, CVA, migraine, all major things, right? Maybe it's just nothing. Maybe because you ate little late, or you ate little less, or you didn't sleep that well, or your eyes are dry because of the heat. No one talks about these things. They talk about medical diagnosis. So I think then you start going to one to another and start reading those symptoms. That obviously creates a lot of anxiety. So, medical problems, please never Google. Most of the patients, when I give medicine also, I tell them, please do not Google about the medicine and look at the side effects. Right? Even if you open paracetamol and Google about paracetamol, it says liver damage, but that doesn't mean you're not taking paracetamol. You're still taking it. So,
Yeah.
Me as a doctor who underwent training, rigorous training, I can tell that, okay, this is not a side effect, this is a side effect, and when you have it, what to do. But Google is not going to tell you.
That's so true. I mean, I can also say I do the same thing. If I have a little bit back pain, I'll go and Google and say, well, why is it happening? So yeah. I think we'll just wait for doctor. I think there's been some network issue. We'll just wait till he joins back again. We finally. I
Yeah.
think there was a little network issue.
No, I got a call from the hospital.
Okay, all right, no problem. Okay.
Yeah.
I so any I think there are some questions also. I think somebody has asked a few questions. We can answer that. But in the meantime, is there any tips, any advice, anything that you would like to share with the viewers? That's something that you personally follow as a routine and you believe in, and that something will help people.
Um, okay, this is something that I usually do. I always anticipate something negative also can happen. I'm not thinking only negative will happen. There's a difference, right? So I'm anticipating that this can happen too. When you anticipate it, what happens is your brain somehow gets used to the thought. When the real stressor happens to you, it doesn't throw a panic attack. It's more or less like you're getting something used to very slowly, right? So I think anticipating stresses rather than being toxic positivity is also a very big deal, right? Where you feel like everything is going to be fine. I know I am perfect. Life is going to be perfect. All that doesn't really happen. So I think anticipating stress is very important and probably preparing solutions for it. Like, I mean, if pandemic didn't teach us that, I don't know what else will ever teach, right? So life is very uncertain. So I think we need to focus. See, now everybody is focusing on relationships. People are focusing on their housing. People are focusing on pets. People are focusing on getting married. People are focusing on having a child. I think with pandemic, I think people's perspective has changed. Where that cat and mouse game of going up the career ladder, people are like taking it little easy. It's okay even if you have 10 crores or 5 crores or 10 lakhs or 5 lakhs, right? If you have a shelter, if you have food to eat, it's fine. While that applies only for some of us, there are a lot of people who are struggling. Like I'm not talking about that, right? That is one thing. And second thing is, I think drug abuse, substance use is extremely common. I think a lot of youngsters they associate taking drugs with something a cool factor. It's very cool. It's very cool to dress up and go have a drink, smoke. I think like when you look at a movie star who is smoking and it's shot very beautifully through the smoke he coming out. I think as a teenager you feel like, oh wow, that's so cool. That person looks very good, right? And you tend to mock it. We tend to imitate it. We tend to also practice smoking. A lot of people do that. I think understand that any drug, it messes with your brain to a point that sometimes you can't come back, right? Obviously, along with the health, your relationships are going to go downhill. Your financial health is going to go downhill. I think sometimes you get outcasted in the society. There are a lot of things. And when if you feel like I'm not an addict, I can control when I want to, it's not in your control. Addiction is something that you can never control. You can never tell that only 30 ml of alcohol a day won't make me an addict, only 90 ml will make me an addict. It depends from person to person. So I think please, when you're feeling stressed, don't go into smoking area and smoke. Instead, find out the healthier alternatives. Smoking has become very common. I think it's such a like across all age groups, across all genders, like everybody. I think it's not healthy at all. It damages beyond what you know. As doctors, we see it, we know it. In fact, doctors also highly stressed, and some of them succumb to smoking because mental health is not even prioritized in the doctors community. So I'm not saying just because I'm preaching right, that doesn't mean, oh, like my community is doing it so well out here. No, we're also human, so we also falter. But it's for everybody. Don't rely to drugs for comfort. That's the most dangerous thing. And don't don't like I follow this, right? I have a drink once in a while, but I make sure I don't drink when I'm alone or I don't drink when I'm sad. That's a pattern I never want to get into. Like I promised myself I'm not going to do that. Some people say that, oh, put music, enjoy a glass of alcohol. That becomes a habit that you can't come out of. I don't do that. So I think these are something that you can do.
Thank you so much, doctor. Thank you so much for all this. I mean, it's been very helpful of you sharing all this with us. Thank you so much.
You're most welcome.
Thank you. Thank you for the time and thank you so much.
Take care. Bye.
Thank you. Take care.